Hello friends, Namaste, Adab, Sat Sri Akal. Hope you all doing good. So without wasting our time, let's get started. So today's topic is IT band syndrome or the iliotibial band syndrome. So first, let's gather information about the iliotibial band. The iliotibial tract or iliotibial band, also known as Meisels band or IT band. The iliotibial band, ITB or IT band, is a tough fibrous band of deep fascia tissue that sheets muscle and muscle groups that is extremely strong and thick. So the arrow represents the origin, that is anterolateral iliac tubercle portion of the external lip of iliac crest. Arrow represents the insertion point, that is at lateral condyle of the tibia Jurdy's tubercle. Action of ITB band are extend, abduct and laterally rotate the hip as well as provide stability to lateral compartment of the knee. ITB therefore crosses two joints, the hip and the knee, and can be involved in pathology in both the areas. IT band stabilizes the knee both in extension and in partial flexion and is therefore used constantly during walking and running. Tensor fascia lata and substantial portion of gluteus maximus and medius insert directly into the IT band. Clinical significance. So, we're going to talk about the iliotibial band syndrome or the IT band syndrome. So, basically it is a non-traumatic overuse injury. Non-traumatic का मतलब क्या है यहाँ पर? That without any wound, without any mechanical stress injury हो रही है. Overuse injury का मतलब क्या है कि बार बार किसी repeated action और movement की वजह से injury cause हो रही है. So, basically it is caused by repeated flexion and extension of knee. बार बार knee पर flexion और extension होने की वजह से वहाँ knees के अराउंड के जो स्ट्रक्चर्स हैं उनमें इरिटेशन कॉज हो रही है, उनमें पेन कॉज हो रहा है. सो बेसिकली दैट लेड्स टू IT बैंड सिंड्रोम. सो व्हाट डज दिस सिंड्रोम मीन्स? सो बेसिकली सिंड्रोम का मतलब क्या है यहाँ पर? ग्रुप ऑफ सिम्टम्स. ऐसे ग्रुप ऑफ सिम्टम्स जो कॉन्सिस्टेंटली अपीयर हो रहे हैं एट द सेम टाइम उनको बोलते हैं सिंड्रोम. सो बेसिकली रिपीटेड एक्टिविटी की वजह से क्या हो रहा है? इरिटेशन हो रही है सॉफ्ट टिश्यू स्ट्रक्चर्स की एंड पेन कॉज हो रहा है. सो इट इज़ अ पेनफुल कंडीशन विच अकर्स व्हेन द कनेक्टिव tissue, that is a ligament extending from the pelvic bone to shin bone, becomes so tight that it rub against femoral epicondyle of femur. एंड जब रब होगी फ्रिक्शन प्रोड्यूस होगा, फ्रिक्शन की वजह से पेन होगा एंड दैट इज़ वाई इट इज़ ऑल्सो कॉल्ड इलियोटिबियल बैंड फ्रिक्शन सिंड्रोम. So basically you can see here a structure of IT band. Origin कहाँ से हो रहा है? You can see here external lip of iliac crest से इसका origin हो रहा है and insert कहाँ पर हो रहा है? Band जाकर Jurdy tubercle of the tibia में जाकर insert हो रहा है. So basically you can see here it is a thick fibrous band and in the IT band syndrome this band becomes so tight that it rub against the femoral epicondyle of the femur so as to produce a group of symptoms and that is called iliotibial band syndrome. So basically you can see here it has attachment of gluteus maximus and the gluteus medius muscle and also tensor fascia lata के भी fibers जो हैं iliotibial band में आकर insert हो रहे हैं. बेसिकली इलियोटिबियल बैंड जो है इट इज़ अ थिक फाइब्रस बैंड जो कि रन कर रहा है अलॉन्ग द लेटरल एस्पेक्ट ऑफ द थाई एंड इंसर्ट हो रहा है इनटू द जर्डी ट्यूबरकल ऑफ द टिबिया एंड साथ ही साथ इसके कुछ अटैचमेंट्स भी हैं लाइक लेटरल पटेलर रेटिनाकुलम के साथ एंड बाइसेप्स फेमोरिस के टेंडन के साथ भी इसके थोड़े अटैचमेंट्स होती हैं. सो यू कैन सी हेयर इन द डायग्राम ग्लूटियस मैक्सिमस मसल, ग्लूटियस मीडियस मसल के फाइबर्स ब्लेंड हो रहे हैं इलियोटिबियल बैंड के साथ एंड जो कि रन करते हुए जा रहे टुवर्ड्स लेटरल फेमोरल एपिकॉन्डाइल एंड इंसर्ट हो रहे हैं इनटू द जर्डी ट्यूबरकल एंड ऑल्सो टेंसर फेशियल लाटा के भी कुछ फाइबर्स हैं इंसर्ट हो रहे हैं इनटू IT बैंड. So basically this is a structure of 30 degree knee flexion as you will see here. So जो iliotibial band है वो exactly lie कर रहा है over the lateral femoral epicondyle and insert हो रहा है वहाँ से cross करके jurdy tubercle of tibia and exactly it is a position where it rub against the femoral epicondyle of femur. So it start rubbing there and produces the symptoms So with knee flexion greater than 30 degree, as you will see in figure, iliotibial band lie posterior to the lateral femoral epicondyle. So as you see in the figure, it shifts posteriorly to the lateral femoral epicondyle so as to assist in flexion or helps in flexion movement. So with 30 degree of knee flexion to full extension, the IT or the iliotibial band shifts anteriorly to the lateral femoral epicondyle. As you will see in the diagram, it shifts anteriorly and helps in extension process or assists the extension movement. So this is the short summary. So at 30 degree of knee flexion, the IT band lie exactly over the lateral epicondyle of femur. And from 30 degree flexion to knee extension, the iliotibial band shifts anterior to the lateral epicondyle of femur. And above 30 degree flexion, it shifts posterior to the lateral epicondyle of femur. So basically, as a knee moves from full extension to flexion, the IT band shifts from a position anterior to the lateral femoral epicondyle to a position posterior to the lateral femoral epicondyle. IT band extends from the curve in the upper border of the ilium, the iliac crest, to the top of the tibia, the patella, kneecap, and the biceps femoris tendon at the back of the thigh. Ilio-tibial band syndrome clinical presentation. History. The usual clinical history describes the lateral knee pain. Pain with activity. So typically the patient with IT band syndrome presents with an serious onset of lateral knee pain that is present during running. Early in the course of the injury, pain usually resolves after running. If the athlete continues to run, the pain may progress to being present during walking and between the training sessions. Pain localized over the lateral femoral epicondyle, the athlete is able to localize the lateral knee pain to approximately 2 cm above the lateral joint line. Untreated, pain may eventually radiate to the distal tibia or calf and up to the lateral thigh. Pain while climbing stairs or running downhill. So pain is commonly experienced when the athlete climbs stairs or runs downhill. So pain may develop with any activity that places the knee in a weight bearing position at approximately 30 degree of knee flexion. Pain at rest. So pain at rest is usually associated with severe tendinitis and associated lateral meniscus tear, an associated lateral femoral condyle bruise, or a cartilage injury. Anytime there is a pain at rest but no history of acute or repetitive trauma, the practitioner should ask question to rule out neoplasm, infection, or inflammatory arthropathy. Thanks for watching.